Hello, welcome to this video. Thoracic pedicle screws is one of the enigmas which haunt every spine surgeon. How to insert them with minimal complications is what we are going to discuss today. Hello, I'm Dr. Rohit Kale. I work in Premier Hospital as a spine surgeon and endoscopic spine surgeon. There are two types of trajectories which are described for thoracic pedicle screws: anatomical and non-anatomical. You can see in this figure, the upper red line shows the anatomical way and the lower red line shows the non-anatomical way of passing a pedicle screw. You can actually pass pedicle screws along the axis of the pedicle, but also there are two more acceptable ways by which we can pass the pedicle screw. You can take a slightly lateral entry point and you can have a more medial angulation and you can still pass the pedicle screw acceptably. You can take a slightly medial entry point and you can also pass a screw, but you have to give much less medial angulation. So you can see the figure. You can see the superior articular facet and the line which is bisecting the superior articular facet. We will come to this particular line, but you can see that the four dots are the possible entry points. So there is a superior medial entry point, superior lateral entry point, inferior medial entry point, inferior lateral entry point. All of them can be potentially acceptable entry points. So this is another paper by Fennelly. This is important. It uses a uniform entry point and sagittal trajectory for all levels. See the superior border of the transverse process and the lateral border of the superior articular process. Just take 3 millimeters, 2 to 3 millimeters caudal to the junction of the lateral margin of the superior articular process and the transverse process. Craniocaudally, the trajectory should be perpendicular to the overall curvature of the spine, that is the posterior elements. So the posterior elements like the superior articular facet and the inferior articular facet, the trajectory should be perpendicular to that the craniocaudally. And mediolaterally, what should be the trajectory? That is T1, T2, it should be 30 degrees. And in the rest of the spine, that is T3 to T12, it should be about 20 degrees. So you can note that the angulation should never be more than 20 degrees in any vertebra, especially if you have taken a medial entry point. But here you have taken a lateral entry point. So lateral entry point, and you have to give at least 20 degrees in medial angulation. The superior facet rule. Superior facet rule is what? The superior facet can be an important landmark. So a midline of the superior articular facet or a line which is bisecting the superior articular facet can be a very important landmark. Why? Medial half of the superior articular facet. Any entry point which is medial to the medial half of the superior articular facet is a no-go zone. So there should not be any entry point. You should not accept any entry point which is medial to the midline of the superior articular facet. That's the superior articular facet rule. You can see in this particular figure that if you can superior articular facet, any entry point taken along these lines, black lines, and if you give even a slight medial angulation, they will enter into the spinal canal. So these are unacceptable entry points. So medial half of the superior articular facet is a no-go zone. So and any entry point which is lateral to this is acceptable, but any entry point, the entry point has to be either along the superior border of the transverse process or it should be along the upper third of the transverse process or maybe middle of the transverse process, but it should never be below the line bisecting the transverse process. Things to remember: medial half of the superior articular facet is a no-go zone. No-go zone. Never along the inferior half of the transverse process. So never too lateral on the transverse process unless you want a out-in-out screw. Never too lateral to the level of the pars. So level of the pars can also be an important landmark. Never too medial onto the lamina compared to the lateral border of the pars. So you want to know the lateral border of the superior articular process. You want to know the superior border of the transverse process. You want to know the line bisecting the transverse process, and you can draw another line at the center of the superior articular process. So you will get a small rectangular zone. This is the zone where your entry point should. You can also see this particular junction, which is a junction of the transverse process and the lateral border of the superior articular process. No go zone, that is the inferior part of the transverse process. Entry point should never be medial to the line bisecting the superior articular process. So this green rectangle is the only place where your entry point is allowed. Any entry point in the gray rectangles is an unacceptable entry point. So thank you for listening, and I'll see you in my next video. Thank you.